Hey guys, this is Theron Duffy. I'm the medical student coordinator for the emergency medicine residency here at Genesis Regional Medical Center. We're very excited to have you guys as rotators in the department and look forward to a great month. Hopefully this is a great opportunity for you guys to not only see a lot of great pathology and learn lots about emergency medicine, but also be able to appreciate and experience some of the neat training opportunities that we have here at Genesis. This online orientation video is mainly designed to give you guys a physical orientation of the emergency department so that on your first day you won't be totally clueless and lost with regards to your physical layout and also your expectation. Now on your very first day you will be meeting with Kathy Johnson, who's the medical student coordinator over all medical student rotations here at Genesis. Typically that meeting is at 8 o'clock and lasts anywhere from about an hour to 2 hours, during which time you'll get your badges. Now your badges will obviously let you into the emergency room on your very first day, and the schedule has already been emailed to you, and so show up to your schedule at the predetermined time. Now, your very first schedule and every schedule thereafter, you will be assigned to either a resident or an attending. We ask, of course, that you stay with that particular doctor during the entire length of your shift. You have also been emailed not only the schedule, but also an extern training packet. And inside that extern training packet, you will find lots of nuts and bolts regarding the rotation, lots of tips and pearls, and we'd certainly expect that you read through that entirely and become familiar with some of the expectations throughout the entire month. And also make sure that we have your email address, as we can communicate directly with you if there's a change in status, if we're going to meet somewhere, because oftentimes we head down to Detroit for specific meetings and lectures and things like that, and we'll oftentimes want to coordinate as a medical student group. And my email address, of course, is on the video, so please email me prior to. So this picture is the picture of the A side. Now the emergency department is really divided between 4 different sections. Okay, you have the A side, the B side. You also have what's called the C side, and then also way in the back you have our chest pain unit called CRDC. Now specifically this is a photo of just the A side, which is really the main side of the ER where all of the traumas and major medical resuscitations come in. Within the A side is divided between 2 zones, A1 and A2. A1 consists of rooms 1 through 9, and A2 consists of trauma A, trauma B, and then also rooms 10 through 17. When you are assigned to the A side, you will either be assigned to A1 or A2. We would ask that you see only patients in those particular rooms. You will have both a resident and an attending working with you, and all 3 of you will cover specifically those rooms. That makes for a nice continuity of care because you'll also have specific nurses that also cover those rooms and techs as well. So this photo is a photo of the A side chart rack. Essentially on the wall you'll find all of the patient rooms with their corresponding charts. All of the charts are placed backwards to conform to HIPAA standards, and down below you'll also find the rack. Now all of the charts and rooms are color coded according to which zone they are in. A1 has the purple charts and A2 has the green charts, and you will find both the purple and the green charts in the rack collectively, and so you'll of course see the patients that correspond to your particular zone. We of course would ask that you see a patient and then present it to your attending and or resident within 15 minutes so as to not delay the patient's care. And of course, if there's any time that you walk into the room and the patient is trying to die on us or needs immediate urgent intervention, by all means walk straight out, get one of us, and we will come take care of the patient together. Okay, so this picture is a picture of the B side rack. you'll find the patients with rooms 18 through 33 here. Now the B side is also split between two different zones as well. You'll have the B side, and then you'll also have Zone 2. Zone 2 collectively refers to charts 18 through 25, and also B side is 26 through 33. And again, these are also color-coded, with Zone 2 being yellow charts and B side, of course, being blue charts. And then right here, where the arrow is where the chart, the rack is, where you'll find both B and Zone 2 charts. Okay, and these are two pictures of the standard rooms that we have here at Genesis. The first picture is just your normal standard room, which of course has the bed, a telemonitor, ophthalmoscope, otoscope, suction, oxygen, and really anything that you need in these particular rooms. These are all the standard rooms throughout the vast majority of the ER. Now the next room also is the trauma room. Now we have two trauma rooms. Each one supports a full resuscitation. It has its own Pyxis in there as well, so you could have all of your supplies for any procedure that you'd possibly want to do. So this is the face sheet that you'll find on every chart for every patient within the ER. When you first get it, we ask, of course, that you date and sign it as well. Please sign under the trainee box and put the date when you actually go see the patient under time seen. And when you're in with the patient taking your very focused history and physical, we would ask that, of course, you discuss the chief complaint, the history of present illness, the past medical history, the very standard things that, as medical students, you guys are taught to do. We would also ask that you write down your pertinent positive physical exam findings, and, of course, finishing with your medications and allergies. And so we would ask that you fill out this particular part of the sheet. However, the rest of the sheet, including the orders, the labs, the x-rays, and any additional nursing orders, that you wait until we discuss those together so that we can have clear orders for the patient and for the nurses and for any additional tests that we have. This is a picture of the entrance to the Genesis Learning Institute, where the weekly Wednesday morning didactics will be held. You'll notice that the entrance is just north of the general entrance into the Genesis Athletic Club, which is right across the street from the main campus of the Genesis Regional Medical Center. Now at 6 a.m., this is where medical students and rotating interns will show up. We will discuss that week's reading material in a roundtable discussion format. And of course, expect you to complete the reading prior to and be able to discuss in depth many of the complicated issues that are emergency medicine.